Hi, I am Dr. Jitendra Goswami. I am a U Nephrologist. I trained in Institute of Kidney Disease and Research Sciences, Ahmedabad. It's a very renowned institute in the west of the India for nephrology and urology. Currently, I work as consultant nephrologist in Internal Hospital, Jaipur. It is a multi-speciality hospital with all high-end facilities in nephrology, urology, cardiology and critical care. Today I will give you the general information about kidney and kidney diseases. For better understanding, I will divide my talk into the several parts like anatomy of the normal kidney, major function of kidneys, symptomatology, high-risk population who can develop this kidney diseases, medical and surgical causes can cause renal failure, and the most important aspect, the preventive measures. Regarding anatomy, most of the people they have two kidneys. Exceptions, a person may take birth with single kidney also. In the location, kidney is deeply located in the upper back, so it's hardly palpable from the outside. Normally one can't feel kidney from the outside. It's a bean-shaped structure. The average adult kidney size is 10 cm long, 6 cm broad and 4 cm thick. Weight is approximately 150 to 170 gram of an adult kidney. Both kidneys drain into the urinary bladder through a tube-like structure. We call it ureter. It's a 25 cm long structure. Normally 1700 liter blood per day passes through our kidneys, and out of which 180 liter per day is filtered. Almost 99% this filter part is reabsorbed, and just 1 to 2% is excreted as a waste product in the form of urine. On an average, adult passes 2 to 3 liter urine per day. Kidney has a lot of functions, but its primary function is to make urine and purify the blood from its waste products. In the removal of waste products, usually we consume protein, and protein is necessary for our growth and repair of the body. And during utilization of this protein, our body produces a lot of waste products, and these products are like poisons for our body, and they are excreted in the form of urine. There are surrogate markers like urea and creatinine by which can measure these poisons. Another important function of kidney is maintaining fluid balance. Our kidney is very smart. We usually try to remove extra amount of water, and simultaneously kidney try to retain the amount of water which is required to body. Supposedly, if a person who is exposed to a heat in the summer and drinks less amount of water, so he will pass very little amount of urine, and vice versa occurs in the winter. One important function of kidney is to balance mineral and chemicals. Kidney play a vital role of regulating sodium, potassium, hydrogen, bicarbonate, calcium, phosphate and magnesium. The change in the level of these chemicals may lead to either subtle symptoms to a life-threatening situation. So kidney is very important to maintain all these chemicals. One important aspect which always overlooked is control of blood pressure. Kidney produces hormone renin, and kidney also regulate water and salt. By all these measures, kidney usually control our blood pressure. That is why a nephrologist always advise, or a primary care physician should advise, if patients come to a high blood pressure in unusual circumstances, like a 14-year-old boy present with blood pressure 170/100 mm of mercury, one should always advise this kidney function test. Another important aspect of kidney function is production of red blood cells. Kidney produces a hormone, erythropoietin, which play an important role in RBC production. That is why in kidney failure, there is deficiency of this hormone, which lead to anemia. Kidney also play a role in the maintaining healthy bones. As I have already told, calcium and phosphate. And one important function of kidney, it converts vitamin D into its active form, which is responsible for the absorption of calcium from the food. So by all these measures, kidney keep our bones healthy. Now we talk about the symptomatology and common symptom of the kidney diseases. The most commonly, as we all know, swelling over face and feet, and in extreme conditions there is generalized body swelling. The hallmark of renal symptom is a periorbital swelling and swelling around the eyelid. Another symptoms are like loss of appetite, nausea, vomiting, high blood pressure, anemia and weakness. There are too many non-specific symptoms like low back pain, itching, leg cramps, and reduction of the urinary volume. Urinary symptom is not only confined to the kidney disease but other serological problems like patient with UTI may present as burning micturition, frequent micturition, and passing of blood and pus in the urine. There are several other conditions in which urinary flow can obstruct and patient has difficulty in voiding like poor stream and drop to drop voiding. As cardiology and many other branches have developed, so far nephrology, so we have a high risk population in nephrology also. Because of this, diabetes, hypertension and kidney disease, it all make a vicious cycle. So these high risk population are almost interrelated. Like diabetic population and patient with uncontrolled hypertension, symptoms of the kidney diseases, person who is having family history of kidney disease, diabetes, hypertension, chronic smokers, obese persons, painkiller abuser, and a person with history of congenital defect of the urinary tract. So these are all high risk population. There are several kidney diseases which responsible for is kidney failure, and majorly divided into the two parts: medical kidney diseases and surgical kidney disease. In medical kidney disease, there are acute renal failure, and more appropriately we call it acute kidney injury. Another entity is chronic renal failure, or appropriately chronic kidney disease, urinary tract infections, nephrotic and nephritic syndrome. Regarding surgical kidney disease, stone diseases, prostatic related problem, bladder related problems, congenital urinary problems, and cancers. Here I will focus mainly on medical renal disease, acute renal failure and chronic renal failure, and more appropriately acute kidney injury and chronic kidney disease. An acute kidney injury we usually divide into three parts: a pre-renal, intrinsic renal, and post-renal part. And pre-renal AKI occurs because of the volume depletion, either because of vomiting, diarrhea, blood loss, and hypotension because of any cause. Intrinsic renal diseases of AKI occur mostly because of infection, toxin, and drugs. And post-renal problem is almost related to all urological problems like stone, prostate, and blood-related diseases. The most common entity in kidney disease are chronic kidney diseases is rampant. As I have already told you, this diabetes, hypertension, and kidney disease all are interrelated. So chronic kidney disease most commonly caused by diabetes mellitus. Hypertension is our second most common cause. Nowadays, another entity is upcoming, which is kidney disease of undetermined etiology. Patient lands with a bilateral small contracted kidney without any obvious cause, and we usually label it kidney disease of undetermined etiology. Another cause of CKD is chronic glomerulonephritis, and there are several miscellaneous causes like stones, infections, renovascular disease, and congenital defects. The most important aspect of my talk is preventive measures. Same preventive measures we should follow as we follow in diabetes and hypertension. Be fit and active through regular exercises, so it will keep your blood pressure under control and blood sugar under control. Another important aspect is balanced diet. Eat healthy diet with full of vegetables and fresh fruits. Avoid refined foods, sugar, fat, salt restriction as advised by your primary care physician. Give up smoking and tobacco products. Beware of this over-the-counter drugs, indigenous medication, Ayurvedic medication, Chinese medication, because this medication may have either painkillers or these medication adulterated by heavy metals or a Chinese herbs called aristolochic acid. These are responsible for the kidney failures, and nowadays cases are increasing because of these drugs. Drinks a lot of water. Most importantly, your annual kidney checkup, especially for high risk population. It has been seen that society is undergoing regular cardiology checkup, diabetes checkups, and many more other checkup, but nephrology part is overlooked. So this high risk population should undergo regular annual kidney checkup. If you love your kidney, do not forget to get a regular kidney checkup after 40 years. So finally, we will discuss the management of chronic kidney disease. We usually divide our management into two parts: medical management and renal replacement therapy. As per the glomerular filtration rate, we usually divide our kidney disease into the 5 stages. Normally, GFR is 100 to 120 ml per minute per 1.73 meters square of body surface area. So, according to this GFR, we usually divide kidney stage into 5 stages. We usually follow the rule of 30, 20 and 10. On 30 GFR, we usually explain renal replacement therapy. On 20 GFR, we secure access for the renal replacement therapy. On 10 and less than 10 GFR, we start this renal replacement therapy. In the initial stages of this chronic kidney disease, we prefer medical management. In medical management, we target anemia through iron therapy and erythropoietin injections, give antihypertensive to control hypertension, diabetes control, acid control through soda bicarb tablets, calcium and phosphate balance, control of volume overload by restriction of water as well as diuretics. And the most important and overlooked entity is diet. I always suggest to take an expert dietitian opinion which will tell you the important aspect of renal diet. Renal diet usually contains phosphate restriction, salt restriction, potassium restriction if required, adequate protein intake. It has been seen that most of the kidney patients they usually stop taking protein in fear of increasing of urea, creatinine and phosphate increment, and adequate calorie intake as per your body weight. Regarding renal replacement therapy, there are two forms of renal replacement therapy. One is dialysis and another is renal transplantation. In dialysis, we have two types of dialysis: peritoneal dialysis and hemodialysis. In peritoneal dialysis, usually we fill patient's abdomen with a specific water or dialysis fluid which takes waste products and gives desired chemical to the body. Usually 3 to 4 cycles of such filling and draining is done per day. In hemodialysis, there is purification of blood through a specific machine called dialysis machine. Usual prescription of dialysis is thrice per week and one session is around 4 hours. And the most important part of the renal replacement therapy is renal transplantation. It is synonymous to the curative treatment of renal disease, and this renal transplant needs a blood related first degree relative in India. Thanks a lot for hearing me, and I wish this information will keep your kidneys healthy. All the best.